National Wear Red Day, and WNCN medical expert and author Dr. Kevin Campbell. He joins us this morning looking dapper in red as well. Good morning. Great
Good morning.
To see you.
You too.
Okay, so let's get right to the point. As we mentioned, cardiovascular disease kills more women than men each year. Why is that?
You know, in society, we believe heart disease to be a disease of men. In actuality, the incidence of heart disease is similar in men and women. Men tend to be treated earlier and more aggressively. Women tend to be undertreated and underserved.
Okay, so when it comes to being aware of, something going on in your body, something wrong, what are some of the symptoms that women can be more familiar with when it comes to heart disease and perhaps an early sign of having a heart attack?
So certainly women can have chest pain and shortness of breath like men can, but women tend to present atypically, meaning they may have flu-like symptoms, they may have shortness of breath and chest pain as well, but may also just have a feeling of dread. Something's not right. So they have to interpret these symptoms within their risk factors. Do they have diabetes, family history of heart disease? Are they a smoker? Do they have high blood pressure or high cholesterol? It's all about context.
And, the young lady, Jill Morin, who I spoke with in that piece that we just saw, she mentioned that she does have the family history, and she was feeling kind of tired and even experienced some flu-like symptoms that you associate with having the flu, but it wasn't that.
Exactly, and that's what's a real challenge for diagnosing women. The most important thing I can say today on National Wear Red Day is women need to take control of their own heart health. Okay. Engage with their healthcare provider. Make sure that they understand their risk and work with their healthcare provider to modify it so we can decrease those death rates in women.
And if they suspect something is wrong, what do they need to do?
If you think you're having a heart attack, you've got to call 911 immediately. If you think you're having symptoms consistent with heart disease, talk to your provider. Find a doctor who will listen to you and think about your symptoms and do the appropriate tests.
Very good.
More women than men in the U.S. die every year. More women die of heart disease than all types of cancer combined. It's a huge risk.
You got to take care of yourself.
Absolutely.
Women are oftentimes the leaders of their family, taking care of the kids, also working, but you got to take care of yourself. Very important to do.
Absolutely.
Dr. Campbell, thank you so much.
Thank you so much.
We're Red for Women. If you have any medical questions for our Dr. Campbell, you can ask him. It's very easy to do. All you have to do is log on to our website at WNCN.com, search links that we mentioned. From there, you can find Dr. Campbell's website. You can also like his Facebook page and Twitter, like I just did.